Hi, and welcome back. I'm Dr. Montero.
And I'm Dr. Coppola.
And the topic we're going to be discussing with you today are statin medications. Those are the medications used to control your cholesterol. So there are medications like Lipitor, Crestor, Zocor, Pravachol, and the list goes on and on. And what we want to educate you about today is the side effects and how harmful this medication is, and the fact that it's still perpetuated, and really it's become quite epidemic, hasn't it?
It sure has, and we know it's been published in the studies. We know that statin drugs do indeed cause peripheral neuropathy. It's known as drug-induced neuropathy. Now, the problem is a lot of the docs are still functioning off the old research, a lot of which was funded by pharmaceutical companies. However, if you look at all the current research, it shows that statin medications are extremely harmful to the body. It can cause muscle weakness, joint pain, memory loss, peripheral neuropathy, dementia, Alzheimer's, cancer, kidney disease.
So, and the reality is, I had mentioned that statin medications really are pervasive. As a matter of fact, 1 out of 4 adults are on a statin medication. And that's 1 out of 4 adults over the age of 45 years old. And let me tell you, this drug is a big player in the market. It generates over $29 billion a year in sales. And as a matter of fact, since 2002, the use of statin medication has increased by 80%.
Isn't that incredible? 80%?
It really is.
Gosh. So, we know that the statin drugs can actually damage the myelin sheath on the nerves. We talked about myelin sheath. Think of your nerves like little electrical wires. There's a protective coating around that nerve. That's your myelin sheath. Well, guess what? When you develop neuropathy or nerve damage, it's that protective coating that begins to disintegrate or degenerate.
It really is. And the biggest problem, the reason why it targets the myelin sheath is, I do want to mention, statin medications are extremely effective at controlling cholesterol. Too effective at controlling cholesterol. They stop cholesterol production in the body, and that myelin sheath is made up primarily of cholesterol. So when you stop cholesterol and you begin tearing it down, you also tear down the main component of the protective sheath around that nerve.
Right, so in other words, just to help our listeners understand, cholesterol is a building block, wouldn't you say?
Absolutely, that's a great way to term it.
It's a building block for the myelin sheath. It's a building block for many things, including the production of vitamin D, even for our cells.
Hormones. Absolutely necessary for hormones. Now, some of the other problems that you have with statin medications is they interfere with the communication from the nerve to the brain. So again, you heard me talk about in one of the earlier segments, it's like getting static, having static on that telephone line. And when you have static, what happens is you get improper messages that get sent down to the nerve. So instead of an appropriate message of, well, I'm supposed to feel hot or cold, all of a sudden your feet may be burning like they're on fire. Or you may feel like you have this sharp lightning bolt, electric shock-like pain going through your feet. And those are all misinterpreted signals coming from the brain. So it's huge.
Yeah, and that's where all the symptoms are coming from. All your burning, numbness, tingling, all the prickly feeling, the cramping, that's all coming from the nerve damage. And many times it's due to, drug-induced damage.
It really is. And what most doctors don't know, and this really boggles my mind, but most doctors don't know, there have been over 900 papers published on the fact that statin medication is highly destructive to the body. 900 research studies published to date that show that cholesterol is not the main culprit in causing heart attacks or strokes. Less than 2% of the population will actually suffer a stroke or a heart attack that have elevated cholesterol levels. And this information is out there. That's how we found it, okay? It's out there and there's a plethora of it, but because your doctors are not staying up to date with the current research, and because they're being educated by pharmaceutical companies, well, $29 billion to the pharmaceutical company, that's a heck of a lot of pocket change, wouldn't you say?
Heck yeah.
I'd like to have 1/10 of that.
You can imagine they have some pretty serious campaigns rallying up these doctors to prescribe these medications.
Oh, you see them all the time.
I'd like to talk to him a little bit about how the muscle weakness comes about. So, when you look at the function of a statin drug, not only does it block the production of cholesterol, but it also blocks the production of something called coenzyme Q10. Now, our cells basically need coenzyme Q10 in order to produce ATP or energy. So if you block the production of cholesterol and coenzyme Q10, this leads to muscle weakness. So all of a sudden your limbs, your legs start to feel heavy, and you start to get the muscle pain and the joint pain.
Right, and you can also develop a syndrome called rhabdomyolysis, which can kill you. And basically what happens is the muscle begins to break down, and the components, the amino acids, the creatinine from the muscle, that's all being dumped into the bloodstream, and it's highly toxic, very poisonous to the body as well. Now, we're not advocating, if you're on a statin medication, we're not advocating that you stop cold turkey. You should never stop taking any medication without consulting your doctor, and you should never stop taking any medication cold turkey because there are serious side effects from doing that.
Yeah, the purpose of this discussion is, of course, to educate you, and secondly, to help you, come to the conclusion that, maybe I need to search for an alternative. Maybe I need to find a doctor who's willing to work with me and find a different way to control those cholesterol levels.
That's so true. Now, the FDA has issued a warning on statin medications, and this is what's really interesting. The FDA typically does not issue warnings until something has become pretty darn bad. There have been significant incidences happening from it. So here's what the FDA had to say. The FDA posts on statin medications warning this medication can cause peripheral neuropathy, Alzheimer's, diabetes, liver disease and liver cancer, strokes, and several different types of cancer, from breast cancer to prostate cancer. That would be enough to scare me to tell my doc, you need to find an alternative method. And there are other cholesterol medications outside of statin drugs that can be prescribed, but right now statin drugs are the norm.
Unfortunately.
It really, really is unfortunate, because I can't begin to tell you how many patients we see coming in with drug-induced peripheral neuropathy, and when we look at it, statins are always at the top of the list, and they're usually on some high dosages of statin medication. So it's something that you really need to become aware of, because it's going to have huge deleterious effects on your health in general.
Absolutely.
So that's a little bit about statin medication. We hope that we've opened your eyes. Please, by all means, go on the internet. Go to our website, nervedoctor.info. We have a blog section, and we've written several articles on statin medication. Everything we write and everything we talk to you about today is always backed up by research. We're not here to give you our opinion. You don't need our opinion. You need the cold, hard medical facts that you're not getting from anyone else. So, thank you so much for joining us today, and we'll see you again next week.
Take care.